morning, good afternoon, good evening from wherever you're watching, and welcome to another episode of Something About Surgery. See, I've been reading this book. It's titled The Emperor of All Maladies. It's a book about cancer written by a colleague who talks a lot and practices a lot of cancer treatment. As I was reading this, I was preparing to operate on a patient with a cancer of the rectum. And then I got a phone call from one of my doctor colleagues telling me that the patient has opted to seek a second opinion, and therefore we are going to delay our cancer surgery. That's why today I thought I should talk about cancer. That famous C word, all of us have heard about it. I don't want to belabor you with telling you what cancer is, because you've heard probably numerous times what cancer is. It is uncontrolled growth of a certain line of cells in your body that takes over, and it can't be stopped. And just goes on and on and on, and interferes with the normal function of the rest of the body. And it can affect basically anything that is living. Anything that is living can have cancer. Why is it important to discuss about cancer as a surgeon? Because I see a lot of cancer in every part of the body that I operate on. I deal with a lot of cancer. Most importantly is that except maybe only two types of cancer, which is cancer of the blood called leukemias or cancer of the lymph nodes called lymphomas, almost, if not all other cancers require surgical intervention. Even for those, the lymph node cancer and all that might require an element of surgical intervention to pick some tissue to establish what the true problem is and define it a little more. So essentially, really, cancer is still bread and butter in terms of looking at the working of a surgeon. Some cancers are grim, others are fairly forgiving. And today I don't want to list the cancers because I cannot list them even if I had a whole day. But quickly talk about just something about cancer. How does someone know they might be having cancer? I have had so many patients come with a small swelling and tell me, I am worried this could be cancer. And I tell them, no, this is not cancer. Please remove it because I'm afraid it might be cancer. Well, their point is taken, because it is always good to be cautious. And today we want to look at what are some of the things that the patients will feel that might tip you to thinking maybe that relative of mine should be checked. Maybe that lump is not the ordinary one. And most importantly, to tell you how the treatment of cancer is arranged. Wherever you are, whether you are in a private facility, in a public facility, in a well-established facility, or in a struggling facility, wherever you are, there is a way in which we approach cancer. So let's first start. You go with a complaint and you present it to your doctor. The doctor will listen to you. We have spoken about history taking. They will listen to your history. Then they will examine you. And then they will tell you, I am suspecting this could be cancerous. Now, what are some of the things in history that could point to one's cancer? They are varied depending on which part of the body is affected by cancer. But what does not vary is what we call the B symptoms, or the constitutional symptoms. Someone with cancer, besides everything else they will complain about, quite a number of them will have hotness of the body. They're just feeling hot. They have fever. Fever is hotness of the body in medical language. Then they might experience a lot of sweating at night. They can't cover themselves. They wake up covered in sweat, even when the weather is not so hot. Fever, night sweats, weight loss. Someone who is fitting okay, has not joined the gym recently, is not skipping meals, but is just wasting away. And what we call is significant weight loss is actually if you've lost maybe 10% of your weight within less than half a year. So if you are 70 and you've lost 7 kilos without intention to lose it, over less than 6 months, then we'll say that is significant weight loss. So weight loss is another constitutional symptom. And the final one is general body weakness or general malaise. You don't feel yourself. You don't have the energy. You don't have the energy even to, take on things that would excite you. You don't have power to wake up in the morning and proceed with your day-to-day duties. So this will end up to maybe certain risk factors the doctor might scout for when they are looking at you, and they will finally tell you, we want to investigate this swelling for cancer. How do they go about it? They have to do an investigation. And investigations in medicine are classified into 4. There are investigations to establish what is wrong, which is to make a diagnosis. And for cancer, you have to take some tissue or some flesh from that lump, submit it to the pathologist, who will examine and tell you, this one shows some cancer cells. So diagnosis must be made. When the diagnosis has been made, then you have another 3 sets of investigations. One is to do what is called staging, to know how far the disease has spread. The second one is to plan your surgery, if you're doing surgery, or plan whichever treatment. And the third or the fourth one is to assess the progress of your treatment you've initiated. So that list of scans and blood tests and all that can actually be summed into investigations to make a diagnosis, investigations to assess the extent of disease or to stage, investigations to plan treatment, and investigations to monitor how you're responding to treatment or if you're getting side effects to treatment. Now, the doctor will order this list of investigations having established that you've cancer. And then they will tell you your cancer is this grade and it is this stage, and therefore the treatment is going to be like this. Now, treatment for cancers can be in 2 ways. One, it can be to cure. We call it curative treatment, and that could be chemotherapy combined with radiotherapy, which is to apply some radiation to the field of cancer, or it could be surgery. But most of the time, it may be a combination depending on how extensive the cancer is, because we will know that even if you will get cured through surgery, some cancers might require some chemotherapy after surgery or some chemotherapy before surgery, just to make the whole treatment a little more holistic and a little more effective. So it could be curative, to aim to cure, or it could be palliative. Palliative means the cancer has spread. This is what we talk about when we talk about stage 4 cancer. The cancer has spread, the surgeon cannot operate or remove it, or the cancer may not have spread, but the patient is so weak. Remember, we spoke about fitness for surgery. Patient is so weak, they cannot withstand major surgery to remove that cancer. And therefore, you then target what is called palliative treatment. Palliative means we are making sure the patient is comfortable, we are making sure that the patient has quality of life, and we are making sure we address whatever symptoms they have. So if you come with pain, we take care of pain. If you come because you can't eat, we make sure you find a way in which you can eat. But we do not aim to cure you of the cancer. So those are the 2 arms of treatment. But without now going into the nitty-gritties, it is important to say one sweeping statement. There are no 2 patients with the same stage of the same cancer who will be treated the same, because cancer treatment is targeted to the patient. That's number 1. And number 2, it does not have a cookbook which you can apply and say, if you have this cancer, go have this treatment. Everything must be tailored. So there is no one single doctor who can manage a cancer patient alone. I see cancer patients, I call in my oncologist friends or medical oncologists. Sometimes I might call my colleagues who are called radiation oncologists, or people who need to give radiotherapy. I call counselors, I call nutritionists, I call all manner of people, because cancer treatment is multidisciplinary. In a nutshell, this is how a patient is assessed for cancer.